Another group which we need to particularly look at is the group which is diabetic. Now, almost every household has somebody who's diabetic, and this group is going to be far more vulnerable than all of us. Now, it's not that every diabetic patient is going to be vulnerable, but we have a whole lot of them who have uncontrolled diabetes. So, if you have somebody who is having uncontrolled diabetes, and I mean, we know them, right? We know that they don't take care of their sugars. They're very callous about it, and they think that they are taking medication, or they're taking some medication, but it is not helping them control their diabetes, so on and so forth. And that's the population we need to get worried about, because the prevalence of diabetes is quite high. Although Indian statistics show about 7% of the population is diabetic, there is a whole lot of pre-diabetics or impaired glucose tolerance who are sitting there at 10 to 15%. Put together, it can go up to a staggering 25% of the entire population being diabetic. Now, why do they need to be worried? They need to be worried that because the virus would thrive in an environment with elevated blood sugars. If the sugars are under well control, there is no issue. But if these sugars are going to be high, we are seeing people post the lockdown, people have a very high HbA1c level. People have not checked their sugars. People have not gone out and done physical activity. Food intake has skyrocketed with the kind of cooking and experimenting with cooking that has happened at household level, because everybody was home, and parents were free, and they were actually getting into a lot of cooking and posting what they were doing. So all this has suddenly and definitely contributed to increase in blood sugar levels. With that, these people become more susceptible, because these virus, if at all, even if a small quantity they have been exposed to it, they could thrive and make it extremely life threatening to all of them. And therefore, glycemic response to the food that we eat is something that we need to look at. We need to look at not only how, what kind of physical activity we need to do, we need to look at how diet can contribute significantly to the betterment of these hyperglycemic values, in addition to the in addition to, of course, the medication that the individual is taking. So it's not that every diabetic patient who's on medication, things are all gung-ho. No, we are seeing that we are seeing a mixed population, those who are pre-diabetic, not yet on medication, and therefore they need a dietary intervention which will work for them. There are those who are highly genetically predisposed. They need to keep a watch. Today, just now, I saw a 35-year-old has a family history of diabetes, and he mentioned he has a HbA1c of 6. So you see, he is at a pre-diabetic level. He's not been put on medication, but the pre-diabetic range is from 5.7 to 6.3. So, and he's already at 6. So if he overlooks this, he could become frank diabetes in a year or two. He was mentioning that his wife's HbA1c was also high, and she has a strong family history in, and many members in her family have diabetes. So these people who have a genetic link also need to be careful, because the pandemic, what it has done is, especially the lockdown, what it has done is it has cut down our physical activity tremendously, and it has toppled our good eating habits. And if these two club together, could be a dangerous combination.